Hello guys, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new today. Today we will discuss about CO190 denial in medical billing. CO190 denial stating that payment is included in the allowance for the another procedure. Nothing but the denied procedure is inclusive to already paid procedure, whatever service is given by the doctor. So we have to understand that it is a kind of bundle services. Guys, if you are watching our video first time, if you not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth, and turn on the notification icon so that you will get every our video as a notifications to you. Hello guys, before we discuss about the denial code CO190 in medical billing, first we have to understanding what is the mean of CO190 denial. Here the denial is used when insurance payers, nothing but insurance or payers believes that the services whatever billed by the doctor already included in another procedure that was performed during the same kind of services. Nothing but, for example, two procedure code billed or one procedure code billed. Insurance is telling that we are not giving any payments to this kind of treatment because the same kind of treatment was already billed by your doctor and we already paid. Now we will not provide any separate payments on this whatever you billed CPT or procedure. Nothing but, in other words, insurance is telling that these are the bundle services, meaning that multiple services are grouped together for a single payment. We will already provided a single payment to you, but in a if you are building separate times, you are building multiple times again, we will consider it this procedure as a bundle. So generally we will get this kind of denial code in a skilled nursing facilities. Why? Because generally we will see this kind of denials whenever procedure whenever surgery was done to the patient, and if there is any follow-up visit regarding that particular surgery, this kind of claims if we are billed to the patient, I mean insurance, at the time we will see this kind of scenarios mostly. Why? Because during a skilled nursing facilities, what happens, surgery was done to the patient and there is some recovery time to recover from that kind of surgery. At the time, during that time period, the care, high level care will be given to the patient by the certified nurses or registered nurses or licensed practical nurses. So along with the doctors or physician assistants also available, but the registered nurses will provide high level care to the patient after surgery was done. If it is required any high level service, then they will provide to the patient, and if they are billing any that kind of claim to the insurance during skilled nursing facility period, insurances will not give any separate payments for that kind of services. They will tell that this kind of follow up already included in a surgery procedure or already included in a ENM whatever procedure billed earlier, and if they got already paid, they will tell that this time we will not provide any payment because this service already included to the prior service. So as a AR caller, we have to understand that insurance is denied the claim or denied the procedure stating that bundle. The meaning, for example, I given a claim billed with the two procedure codes, ENM code or surgery code. They will pay to ENM code or they will deny the surgery code, or otherwise sometimes also it will be happen they will deny the ENM code and they will pay the surgery code, and the meaning is the same. They are telling that the payment already included in another procedure. That might be the date of service is the same, or otherwise the date of service will be the global to surgery, like 90 days, 50 days, 10 days. It is a depends on a severity of a surgery. For example, surgery was done, there is a global period 90 days. Within the 90 days, if you are billing any ENM code, then insurance is telling that this ENM code is denied as a bundle to the already procedure whatever we paid on a surgery. So we have to understand as a AR caller that there are a two CPTs, for example, billed on a same claim also, they will pay partially and they will pay denied another procedure. We have to understand that it is a already included to another procedure. Okay, now we will discuss about what are the pre-call analysis steps for CO190 denial. The first step is, this first step is common for any denial. First one, if you are a absence of response from the payer. For example, a doctor billed a claim to insurance and there is no response received from the insurance. At the time, as a AR caller, you have to verify all internal sources. Nothing but internal sources are nothing but your doctor software. Generally, we can call it as a practice management system. And if you are not finding any information in your doctor software, you have to verify your doctor's internal clearing houses for the claim status. For example, if you are not finding any status in your PMS or clearing houses, then your last source is you have to verify your respective payer portal. If you have a access, you should have to verify the portals for a claim status. And for example, if already a denied EOB posted with a CO190 code in your PMS, then as a AR caller for CO190 denial, you should have to verify if the denied CPT is included in the payment for another CPT code. So you have to understand that, okay, for this denial code CO190, nothing but it is the meaning of already included to another procedure. So we have to understand that does another CPT already paid, if we billed or not, if billed it was paid already or not, if paid that kind of services related to this CPT or not, you have to understanding by seeing the diagnosis codes and also by seeing the medical records. So at least you have to understand that the similar kind of procedure code or any other procedure code is billed this kind of related services to the insurance or not. So you have to check your previous CPT information in your software. And also you need to check if the denied procedure was already appended with appropriate modifier to get the separate payments or not. So nothing but if claim is denied for CPT, you have to understand that this denied CPT is already appended with the modifier or not. For example, if already appended with the modifier to get a separate payments, you have to understand that you need to call and prove that we already appended a modifier to get a separate payments. So in that way, the pre-call analysis is useful for the CO190 denial. Okay guys, now we are discussing about AR callers on-call steps for CO190 denial. If no denied EOB found from our side, your first question is, may I know the claim status please? For example, as a pre-call analysis, for example, we understand and we checked all internal sources. We doesn't found any EOB from our software or from our sources. Then you have to call to insurance. That is a very final last option that we have to know the claim status. Then you should have to call to insurance and you have to tell that, for example, hi, this is Thomas calling from provider's office checking on a claim status. So, may I know the claim status, please? That is the first question. May I know the claim status, please? Because we don't found any information from our side. And for example, if rep is provided, the claim is so and so reason. That's okay. For example, here the next point is I given if denied EOB found from our side with the denial code CO190 that was already posted in a PMS. At the time, your question to the insurance representative as a AR caller is directly, may I know the denied clarification please? So if you are asking directly this question, may I know the denied clarification please, at the time insurance representative will understand that you have already denied EOB with you and you have a you have a denial reason also, you know. So that is what you want more clarification on the denial, the insurance representative will thought. So if you are asking for denial clarification, the insurance representative will answer you that this claim is denied for already inclusive to another procedure, whatever you build similar kind of services. At that time, if you know, okay, if you don't know, you can ask like this, may I know the to which procedure the denied CPT was included? So if they have that information, definitely they will provide that information. If they are unable to provide that information, as a AR caller you can request a claim back for reprocess, because does mean that they, if they are unable to provide the other CPT to which CPT code it was inclusive, means there is a no other CPT was built, or there is no other similar kind of CPT was built. So at that time insurance rep will reprocess the claim if they are unable to provide to which CPT code was included. And also you can ask this question, which modifier is appropriate to get a separate payments. So you are given a denial that I'm giving explanation here you have to understand that insurance telling that we will not give any separate payments. At the time as a AR caller you have this question, no problem, you can ask which modifier is appropriate to get a payments on this kind of CPT code. Mostly insurance representative will not provide any modifier information on a call. They definitely they will suggest you that could you please reach your coding or coder, internal coder, to get a appropriate CPT. At the time no problem, you will get that kind of suggestion from insurance representative, and you will approach your internal coding team, no problem. For example, if already denied procedure already appended with a appropriate modifier, for example insurance is denied but the denial CPT already, for example insurance is denied ENM code stating inclusive, but that ENM code is already appended with 25 modifier. So we have to understand as a AR caller that this modifier 25 is used to that CPT code, nothing but it is giving additional information to the insurance that this is unrelated ENM code during the, I mean this is an unrelated ENM code billed by the doctor on a same day. So for example two CPT codes billed on a same date of services, one is paid, other one is denied, nothing but denied procedure is ENM code already appended with 25, nothing but this is not a related to other CPT code, we want separate payments. So as a AR caller you have to understand, this is a basic understanding that we want separate payments because it was already appended with a 25, could you please reprocess the claim. So in that way you can reprocess the claim. For example ENM code billed and surgery code billed, ENM code was paid and surgery code was already appended with 59 modifier, then you have to tell to the insurance that it was already appended 59 modifier, nothing but it is not in this build two CPT codes are not inclusive to each other, so they can perform together but it will be not inclusive to together. So we want additional payment or separate payment for this CPT code also. In that way you have to give your valuable uh, information or additional information so that insurance representative will understand and review and reprocess if possible. So if they are reprocess a claim, then take what is the reprocessing period of time. Generally it will be 30 business days or 15 to 30 or 45 business days. Then you can take reference for that reprocess and you can take the call reference number and a claim number, you can close the claim. For example they are unable to reprocess the claim or there is a no modifiers are appended, at the time you can take what about the corrected claim mailing address and timely filing, and also you can take what about the appeals mailing address and timely filing. So by taking this information you can take the call reference number and claim number, you can close the claim. So these are the basic very basic AR caller on call steps for the CO190 denial. Okay guys, now we are discussing about what kind of end actions we would like to take as a AR caller for a CO190 denial in medical billing. Here the first action I given as a reprocess the claim. For example this action will become, for example denied procedure already appended with a uh, appropriate modifier to get a separate payments. As a AR caller you should have to probe that information over the phone call and you should have to reprocess the claim on phone call itself. In that case we will go for reprocess the claim. And here the second action I provided as a coding review. For example the denied procedure not appended with any modifier, and you have a uh, thought that okay these are the not separate payment, I mean these are the not inclusive payments. These are the not inclusive procedure code. If we are adding appropriate modifier, there might be chance or there might be possible to get a separate premiums from the insurance. At the time, you can task this claim to coding team assistance or coding review, so that your internal coder will review, and if required, the internal coder will append a appropriate modifier to your claim and they will submit a corrected claim if required. So as a AR caller, your job, if you are not unable to understanding what kind of appropriate modifier, it is a better you can task the coding team, so that coder will review and rework accordingly. If it is modifier required, they will add modifier. If they feel that it doesn't require any appropriate modifiers, it is really similar kind of services, they will tell that you can go for adjustment. Or otherwise, if already appended with modifiers, appropriate related modifiers, again you are tasking to coding, they will tell that it is already appended with a valid modifier, then you can go for appeal. So accordingly, you should have to work based on a coder follow-up notes as a AR caller. And final action I given as a appeal to prove the separate payments. So your internal coder is telling that whatever coded internally at the earliest is the correct. And insurance representative also not refuse to reprocess the claim over the phone call. What is the last action as a AR caller you will do? You can appeal this claim, right? So how you can appeal? You can appeal if you believe the services should be paid separately, nothing but it is not bundle, then you can send an appeal with a relevant or sufficient or whatever required medical records you can attach to the appeal letter, and also if required policy information and other supporting documents, whatever required to strengthen your appeal case, you can attach to your appeal cover, and you can submit a appeal to the insurance to prove the separate payments. So these are the basic actions on a CO190 denial. So these are the points I given here, guys. Before taking any final action on a claims, please ensure that you have to follow your process specific updates as a priority, and even client protocols as a priority. Still, if you need clarification is required, if you felt that clarification is required on your action of a claim, could you please consult your respective RCM supervisor for a better clarifications. Guys, if you felt content is useful, could you please like our video, so that it will reaches many more needy people who are looking this kind of content. It will reaches them easily. And again, thank you so much for your time. Have a good health. Bye for now.